Good morning. I'm Laney. I am a genetic counselor and assistant professor in the United States at Emory University in Atlanta, Georgia. And I'm really excited to tell you about artificial intelligence and what the future and current state of using it in Fabry disease might be. Let's start out with my disclosures. I work with a lot of the companies doing research and giving educational lectures and getting grants to hold more lectures and educational events. And then I'm a co-founder of Think Genetic, which is a company that is moving into artificial intelligence when it comes to genetic diseases. So what is artificial intelligence? You hear this word, you think of robots, you hear AI, and it sounds really fun, and there's lots of movies that include it. But at the bottom of what AI is it's just combining computer science to computate its way through big, giant data problems. So what you have to do is you take a computer or a computing area, a bunch of computers working together, and you train them on how to think about things. And you give them really large sets of data that help them understand how to think about things. So in many people's everyday life, they already see applications of artificial intelligence. If you think about when you do a phone call and like if you're calling the airlines and they say, tell us your frequent flyer number. And you rattle off your frequent flyer number and then they either respond, okay, I'm moving you to an agent, or what can we help you with, or give you a menu. That is a form of artificial intelligence. It's taking your information, synthesizing it like a human would, and then trying to route you through the phone tree the way they'd like to. So it's a step better than when we used to have to press the buttons all the time. Also, you think about your digital assistants on your cell phone or your devices that hang around the house. That'd be like Alexa and Siri. Those are great examples of complicated artificial intelligence that's able to use huge amounts of data and listen to you in order to do what goes with that. Think about when you use Amazon or other places that you search things on the internet and suddenly you see it everywhere. That's artificial intelligence who's presenting you with other options. And artificial intelligence does things like at the airport, where they look at your face, do facial recognition, or on your social media, where you see pictures and they recognize what's going on based on points in your face. All of that has to do with artificial intelligence. So the other thing that artificial intelligence is able to do is it uses something called natural language processing. You'll hear NLP said all the time with this. And this is just a segment of artificial intelligence that is able to move through large pieces of data looking for key phrases or key words. And the goal of that is so it can pull things out of really big data sets like your medical records to kind of understand a little bit better what's going on without using somebody's human eyes to go through it first. Now, is it perfect? Oh no, not by any means. But this is just an example of how it might not just look for keywords that relate to medical conditions, but also look to see an exam and see, is this a negative incident? So did it say this is normal and there's no evidence of this condition? Or is this something that we saw when we examined people? So it's not just looking for the word, it's connecting with those around them and how close they are, which is a nice way to get through what we call unstructured data. Unstructured data in medical records is just things that your doctor has typed in instead of things that are like coded. So by coded, I mean where they type in a code and it brings up a diagnosis, or your lab results, or certain things that are very specific and you can only enter one thing into the field. This is the free text that makes up a whole lot of what we look at in medical records. So long story short, it's a way to use artificial intelligence to look for important pieces of information in large data sets. AI is everywhere. So you can see it in education, healthcare, and customer service, in games, in robotics, growing plants and crops, buying things, social media, finance, surveillance, all over the place, right? But it gets a little bit more specific when we talk about AI in healthcare. And healthcare can be involved in almost every aspect of what we do and how we help people with medical issues. One of the first ways that AI has been really useful in Fabry disease and in the rare genetic disease space is in the diagnosis, because we all know that when you've got a bunch of nonspecific symptoms that may mimic or look like other diseases, putting together a diagnosis for someone who doesn't know what's going on and that it could be underlying genetic is like doing a really complicated puzzle where half the puzzle pieces are invisible, right? Because when we think about Fabry disease, as you go along, symptoms become more evident. But in the beginning, when someone's having burning pain in their hands and feet when they're a little kid, and you're trying to figure out why they're having, constant diarrhea and throwing up or not being able to eat or can't do PE, In the early days, that's really nonspecific, and it's only as things start coming together, but you still have to think about pulling different pieces from all over a medical record or ask the right questions in order to get to a Fabry diagnosis. So how could artificial intelligence help with that? Well, one thing that happened is Dr. Jeffries, who's a cardiologist at Vanderbilt in the United States, he got a big giant data set of health data, and he found out which patients in there Fabry disease, and used that to train artificial intelligence to look for patterns of symptoms based on ICD-10 codes. So in the US, these are the codes that you use to get billing done. I'm also looking for some other features in that. And what he was able to do is train the artificial intelligence to predict what the likelihood is somebody with a random set of medical records could have Fabry disease or not. So that's pretty exciting as a step that says, hey, if we can find patterns of symptoms and lab values, maybe we could diagnose Fabry early. And that's exactly what has been done with other work. So again, the company that I work with, Think Genetic, has taken that kind of approach and looked for patterns and negative symptoms and natural language processing to look through electronic medical records and find people who look like they could be at risk for Fabry disease. Now, we call this a diagnostic assistant, which basically means we're not trying to replace the doctor. We're trying to put Fabry disease in front of the doctor and say, like, hey, based on these symptoms, your patient could have this. Here's how you get them tested. Here's where you refer. It's just trying to help them and then feel empowered to say, well, this could be this rare genetic condition. Maybe I'm going to look at my patient closer, as opposed to feeling like, somebody Googled this and is going to put this in front of the doctor. The goal is to start the conversation between a doctor and a patient to see if their health symptoms could have an underlying genetic cause. And then I think this quote from Benjamin Bell, who's a Scottish surgeon, is really kind of encapsulates up. AI will not replace doctors, but instead it'll augment them, enabling them to practice better medicine with greater accuracy and increased efficiency. And this is not just something that we're doing at Think Genetic. There's other companies and things that are thinking about this as well. How best do we do this in rare disease with Fabry disease, as opposed to other rare conditions or cancer conditions or things like that. The other thing that's going on is that there are chatbots that look at gathering people from the internet. So if they're Googling in the middle of the night trying to figure out what's going on with their health, what's going on? Why am I having this? Why does my family all have early kidney disease? Why do I have this rash? It tries to capture them then and then walk them through with what looks again like a chatbot, where they present symptoms. They say, oh, you had a corneal whorl. Are you interested in learning about if you could be at risk for Fabry disease or an underlying Fabry disease? Oh, you are? Okay, well, let's start. How old are you? Are you male or female? Has anybody in your family ever had this disease? Anybody had renal failure when they're under 50? And what it does is it asks the right questions so that you can give an answer that's yes or no. Because how often will a doctor say, do you sweat, unless they know that there's a chance you don't sweat? When it comes to corneal whorls, how often would you ask about corneal whorls if an eye doctor has said that they don't impair vision, so it's no problem? So really, what solutions like this are doing is trying to capture people when they have the questions, motivated people looking for answers for their health problems, and then using artificial intelligence to ask them the right questions to learn if they could be at risk for something. And then providing information for their doctor. Good information, like specific information, not like giant reams of paper that no doctor wants to see. Another way that they've been looking at using AI in Fabry disease is facial recognition. So I actually had a student who did one of her thesis projects in this. And there's also been additional work. You can see here that in the Netherlands, they did some good work here, and there's other people as well. There's a company that's been working on this in rare diseases for a while now. But what they're using is facial recognition in Fabry disease. And they're taking like an average face, and they do it with different racial ethnic backgrounds. And they find out what's different about the face using thousands of little points all over the face. And then based on that, they develop what a pattern might look like in Fabry disease. So if somebody has a picture taken or a 3D rendering taken, then they can say, oh, this Fabry disease might be a possibility here based on just some very subtle differences. If you have been to a Fabry conference, sometimes you see that some of our guys, as they get a little bit older, look like they're cousins, right? They look like they're more related than maybe the average person. Perfectly handsome faces, but maybe a little bit more like each other. And that's what this is trying to capture, is even things we can't see that are subtly different, like the tip of the nose or the broadness across here between the eyes, just little tiny subtle features that might indicate somebody could have Fabry disease. So that's another solution with AI that they're working on to diagnose Fabry disease. Now, the other thing that we're doing is, when you take a medical genome or whole exome, what they're doing is they're going through all of the spelling of your DNA and trying to figure out if there's some that's changed from what is a kind of an average set of DNA. But the problem is the doing of that sequencing is fine. That's not so hard anymore. We figured it out. It took a long time, but we figured it out. Now we can do it really fast. But then you have to figure out which changes cause conditions or which changes don't. And if you don't have good data about the symptoms somebody's having, you may just miss that there's a gene change that matters. So many companies, not just this company, what they've done is they've taken large sets of data about symptoms, genetic conditions, different misspellings in genes, ancestry, all these big sets of data, and they've pulled those together so that the artificial intelligence computer program can look at the changes in these genomes and exomes and do a better job of predicting medical issues, predict what change could be related to a disease or not. Now, humans have been doing this forever, and they've been coming up with different systems that help you do that. But again, it's still not perfect. So what they're trying to do is use artificial intelligence that can collect all this big data and put together patterns to try to figure out if we can do a better job of predicting which changes in the DNA actually could be causing health problems. All the goal for all these artificial intelligence applications are really there to decrease the time to diagnosis and treatment for Fabry disease or other genetic diseases. And the goal there is, the earlier you get treatment, the better the outcomes and the better of quality of life. And that's what all of this AI application is trying to do in Fabry disease. And those are things that are already happening now. So these aren't like science fiction future ideas. These are all currently happening in different stages. What else can we use artificial intelligence for? Well, some of this is already going on and sometimes not. One thing that we look at with Fabry disease is we kind of know the main symptoms, right? The top 10 hit list of what the symptoms are in Fabry disease. You think about proteinuria, early kidney failure. We think about hearing loss. We think about heart disease and arrhythmias. We think about gastrointestinal. We think about angiokeratomas and corneal whorls. Like those are their top 10, right? But there may be symptoms and health problems that we don't recognize because we're so focused on the ones we know. And one of the things we think of is, well, if we use artificial intelligence to review a large data set, all medical records that are available, then could we find other things that we're seeing more often in Fabry disease, but we're not thinking about or treating? So this is a way of trying to do that using big sets of medical records. And back when we had paper charts, if you had Fabry disease in a paper chart, you would have like multiple volumes this big. Well, now it's electronic. So now we can dig through it with the artificial intelligence much easier. So this may be able to tell us, do we have somebody who's got low bone density all the time? Are migraines more frequent in Fabry disease? Is autism more frequent in Fabry disease? Maybe, maybe not, but if we can find that, then we can figure out why it's happening, and then we could try to treat it. And that's a big deal. So artificial intelligence can help us define disease characteristics. One thing that goes on behind the scenes is that a lot of the tests you do rely on a person using their eyeballs to look at a sample or a picture or an MRI image or an X-ray. Artificial intelligence can be trained to look for patterns in these images as well. So Dr. Najafarian at University of Washington in the United States has developed a very strong method for looking for storage of those globotriacylceramides and those glycolipids in kidney cells, and then patterning it so that we know if things are getting better or worse. So it helps with progression of disease, staging of disease, and response to treatment. Other people are doing it in other things. So really just harnessing the power of artificial intelligence to look for patterns and looking for it in pictures as well as words. So that's something that's happening as well. Another thing that's in the United States is we have these things, these chat bots, and they're in other places as well, and they can use them to help you with your medical care organization. So there are ways you can use a chat bot to have consent. So you can consent to a surgery, you could consent to doing a study, and also get your questions answered because the artificial intelligence has been trained on how to answer most frequent questions. Now, is it perfect? No, but it's very helpful. It can also help you set up appointments. They can call you for a reminder. It can link you to a specialist. It can tell you it's time for your follow-up things. You got to go do your echo, you got to do EKG, make sure it's in there. So really, artificial intelligence can if it can be set up to help manage your reminders and healthcare as it moves through things. It can also, as it's been trained to answer simple questions related to results or genetics or family history, can also be used in some cases to provide basic results or answer basic questions about genetic conditions, including Fabry disease. So interesting, right? Not going to replace a human, but a nice way to kind of get quick answers before you move on into the human who can give you stronger, deeper answers or answer questions that are not as straightforward. Another way, there are companies who are using artificial intelligence to look at big sets of medications that are already been developed and have different mechanisms and see if they could apply to other conditions like Fabry disease. So they basically take data about what you're trying to fix, you combine it with giant data sets about what different medical therapies already out there do, and then you look at all the other biochemical and commercial information you need, which gives us giant sets of data yet again. And then they look for patterns in medications that might be good for clinical trials to solve certain problems. So there's several companies doing this. It's called drug discovery, which is just a fancy way of saying looking for treatments within existing sets of medications. So what's next? Artificial intelligence, I just told you about all the things that could be and some things that are happening in select areas. What could happen next? Well, using big sets of data, if we have lots of patients' information on Fabry disease, we might be able to predict in the future, if you've got multiple medications out there, what medication, what dose might be most effective for you. We could maybe say, oh, for this young child, when should they begin therapy based on all the other children who have this type of mutation in the GLA gene or have these symptoms right now. Maybe it'll help us better track disease progression. Maybe we could help us better understand which women might have symptoms at what point in their lives. They could go through your records and tell you if you qualify for a clinical trial. When you think about artificial intelligence, think of it as trying to be like a people extender. Not a way to replace our doctors and our genetic counselors and our humans that are in our lives, but a way to try to make them more efficient so that the big stuff you're asking your doctors, the thing that you need your doctors for, they're there and they can spend the time to do that. Again, it's just one way to try to solve problems using artificial intelligence, but it's an interesting one. So I hope this talk has kind of walked you through some of the interesting things you can do with artificial intelligence. I now will take any questions through messaging or chat that you'd like to ask, or you can email me directly. Thanks for your time.